Today I'm going to talk about LDN, something called low-dose naltrexone. It's a very unique compound that we do in our compounding lab, but it has really risen to the top. We are seeing a lot of positive outcomes with it. It's being used for a lot of different things. It's well published, well researched. So I want to offer you some information on it. This video may get a little bit long. Be patient if you're really interested in it. Take the time and listen to it. Naltrexone is a drug that was patented in the 60s or 70s. FDA approved it in the 80s and 90s. It was used for alcoholism and drug addiction. So people who were addicted to heroin sometimes were court ordered to take naltrexone because it blocks the opiate receptor. So when they ingested a narcotic, it put them into withdrawals, which is nasty. So people who were forced to take it as part of a plea agreement or a conviction found that if they ingested the drug on naltrexone, they would get sick. Now the dose they were taking for therapy like this was 50, 100, 300 milligrams. A couple really smart physicians, Dr. Bahari in particular, really looked at the chemical structure and how it affected the opiate receptor and decided they wanted to try it in a very low dose for very different reasons. Dr. Bahari was treating AIDS patients in New York City, and he found when he gave his patients very low doses, 1 milligram, 1.5, 2, 3. Remember, we're talking 300 milligrams. Now we're talking 3 milligrams, thus low dose naltrexone. He found his patients were healthier, their immune function was better. They weren't living, but they were living longer. And that's before our AIDS cocktails became part of the medical community and really are a place to treat people. So LDN was one of the first things that we started to see a positive outcome in this patient population. So from that and from the outcomes of what Dr. Bahari's patients were, other researchers and physicians really looked at it. So for affecting the opiate receptor like this, what else can we treat? And when I started looking at this, and I learned about it from a MS patient, he called me several years ago wanting to try it because in a support group it had been mentioned. He still takes it, by the way. This has been 12, 14 years ago. So I learned about it from him, but it really spurred me to learn more about it. And there wasn't much information. So we were looking at the research and the literatures, and PubMed is a very popular go-to place for physicians. It's where published literature is posted. There were a couple hundred articles on LDN. Now there's thousands of articles on LDN, science-based research articles, positive outcomes. A book was written called the LDN book in 2016. It's edited by a gal by the name of Linda Ellsgood, who I actually have met personally. We had dinner one night with a group of pharmacists. She's an MS patient who survived, and she actually is crediting LDN as a big part of her survival. So she edited the book. There was enough information about different treatments that it warranted, and the Health Trust is out of the United Kingdom. Book 2 came out in 2020 because there was that much more information, that much more references, that much more treatment protocols. And now we're into LDN Book 3, published late last year. And again, it was done just because of the added information. Now, the subtitle to the books were Low-Dose Naltrexone, Revolutionized Treatment for Autoimmune Disease, Cancer, Autism, Depression, and More. Book 2, Revolutionized Treatment for Post-Traumatic Stress, Pain, Lyme Disease, Dermatological Conditions. Book 3, Recent Research on Viral Infections, Long COVID, Mold Toxicity, Longevity, Cancer, Depression, and more. It can be effective for these things. The trick is really finding somebody that understands it, is willing to prescribe it, or willing to consult with me or my staff on dosing and its usages and what it can be used for. To me, it's really the platform for compounding is the triad of care. The prescriber, the pharmacist, and the patient all working together to get the best outcome for that patient. This is the triad of care. It's the prescriber communicating with you, communicating with me communicating with you. Where's your dose? What outcomes are you seeing? Do you feel better? Is your outlook better? Everybody seems to have a magic dose. That's the difficult part, finding that magic dose. So more and more, we're starting lower and going slower. We used to do 1.5 milligram for a couple weeks, 3 for a couple weeks, 4.5 maintenance, and that was our protocols. Now we're doing 1/4 milligram, 1/2 milligram, sometimes for 2, 3, 4 weeks, slowly increasing it by 1/2 milligram for another 2, 3, 4 weeks, making sure we don't miss the magic dose. Sometimes we'll increase a dose and patients don't feel as good as they did before, so we're going to back it up. So it's very important, if you're going to look at LDN, and we are certainly going to help you with that, that you understand that it can take a while. I have some people that it took 6 months before we really got the outcomes that we were looking for, but we were dealing with some maladies that were very, very debilitating, and we resolved them for the most part. Now there's other parts of their protocols, but LDN is one of the things that we're using that I firmly believe is very important in the treatment and the healthy outcomes that they're getting. Not only humans, we are really starting to see some inroads into vet medicine. I have a friend in Madison. He has several case studies of dogs being treated for skin conditions, tumors, behavior conditions. We have a local patient, a Weimaraner, who just got very arthritic and just kind of debilitated, lost all its hair, didn't know what to do, tried everything that we normally would. She communicated with me because she was taking LDN if she thought it would help her dog. Her vet wanted to try it, and it did. Hair grew back, mobility came back, lost weight because it became more active. She says it's like a new dog. So there's a lot of things that we can look at. I have a few patients who have been addicted to, say, hydrocodone or a narcotic, and they wanted to try to decrease their usage. The only thing that you can't do with LDN is take a narcotic, because it's going to put you into withdrawal. But with a commitment, we were titrating people very, very, very slowly onto LDN and able to decrease their Vicodin usage because their pain was being partially managed by the LDN. Now, we did that with quite a few. I would say we have 2 success stories where people are using LDN for their pain management and do not take a narcotic at all. So again, it's a very, very individualized therapy. It takes a team to make it work. We're part of that team, I think, that can really help you investigate whether LDN is an option, whether it can help you. And I think it's really worth trying. If you're interested, stop and ask. I'm more than happy to give you a book or borrow it to you if you want to bring it back. Give it to your physician, give it to your friends. I get a deep discount on these from the Health Trust out of the UK because of my relationship with them. So I'm willing to offer it to you at no cost. Just ask that you read it, bring it back so I can give it to somebody else or pass it on to some friends and family. So that's my LDN story, and I'm sticking to it.